I mean, this woman can eat absolutely. If you put freaking chip with Hershey on top, she eats it and she gains muscle. That's the way she is. So, she complains sometimes about eating. I'm eating because the drug reps bring you food. Oh, I don't want to eat that junk. But she eats it. True or false? I mean, she eats 3 hamburgers that is 3 pieces and she will eat it. Doesn't matter what it is. But those are people that you need to watch out for. If you're going to bring food, don't eat it if it's not good for you. Use fasting as a way to do it. So for example, if you're at work and you're going to have a lunch, but they're going to bring pizza or something, hey, I'm going to fast during that period of time. Let me fast. There are some questions that you need to ask. How long do I need to fast to make a difference? That's the first question you need to do also. Okay, here is the answer. And I presented this yesterday, and I went through it really fast, but today I really want you to be aware. If you eat, you're going to use exogenous means sugar that it comes from the outside. You're going to use it. But if you start fasting, within 4 hours, actually, you're going to see a change on your metabolic system. And I will say this, when you are fasting, about 4 hours, you're already changing metabolic things in your body. 4 hours. So, why 4 hours? You guys know why 4 hours? The liver, absolutely. We are meant to eat every 4 hours when you are awake. Not 6 times, not 7 times. The circadian rhythm is amazing. There's something called MMC, moral migratory complex, and it works in a 4-hour cycle. Now, I know how people are like, Steven never gets up, never goes to bed at normal time, right? So he's awake here. So you have a longer cycle of life, but you're supposed to eat every 4 hours. It's the best way to lose weight and to keep healthy. The liver does have these contractions, cleanups every 4 hours. When you eat between meals, and I know the dietitians tell you to eat snacks, okay, between meals, it's absolutely bullshit too. Let me explain to you why. In the old days, before supermarket time, okay, you were going to go outside and go find your food. Okay, meanwhile you find your food, by the way, you don't have a shotgun, you don't have any of that shit, okay? You have to go really hunt it. You will run after this animal, and the animal will go somewhere, right? And now the only time you were able to eat, you stop and grab a fruit or a little freaking almond, who knows what it was then. That was the only time that you were able to do that. But what were you doing? You were running, you were exercising, you were doing something to get to that animal. Once you kill that animal, do you have a fridge to put it away? Hell no. What are you going to do when you kill that sucker? Eat as much as you could at that one time. Now, that means that if you have 3 or 4 people with you, you ate that time and you have to wait to the next meal. So we were kind of like snakes. We ate when we could. And then, now, what happened if we didn't eat the whole thing? What do we do with it? You guys know what we did with it? In the literature it says we hang it up because we didn't want animals to come and eat it, or what do? We bury it. What happened when you bury the food? What do we get? Bacteria. Tons of bacteria. So it was a way of fermentation, actually. Okay, and then we go back and eat it. That's the way we ate. All this fasting is very important. Now, you need 4 hours of fasting to make a difference. So, you say, oh, I can only fast for 2 hours. Don't waste your time. For weight loss, you want to at least have a 4-hour time if you're going to do any type of fasting. Now, you went to bed. If you sleep all night, how many hours is that? Supposedly 4 to 6 hours, okay? Now, what happens? This slide what happens when you starve to yourself? Free fatty acids, that means fat becomes the main source. Now, I want to ask you a question. What is the main source of fuel for the heart? You guys know what it is? What is the main source of fuel source for the heart? Fat. No, it's fat. Okay? Also, the heart uses something that you guys never know. Taurine. It's an amino acid and it uses for a fuel source. Okay, so remember that. Now, look at this. This is the number of hours in your blood. What happens when you don't eat? Okay, and these are freaking ketones here, or days. You can see as we go, the longer the days that we don't eat, the more fat we burn, the more ketones we use, so all that happens. In starvation or when you don't eat, the main fuel for the brain will be ketones then. Glucose still really important. Okay. I put this slide here because remember I told you I might make you fast for certain proteins. It's because proteins affect your sugars levels differently. Yesterday, I asked a question to Dr. Alexander. I said, can you measure food allergies through HRV? Dr. Alexander, because he's so polite, he said, I don't have the research, because he's a researcher, but if I sat down with him privately, he said, oh shit, yeah, you can. But, he doesn't want to tell you that, but you can. The reason I put this slide there is because I want you to see what happens with proteins to glucose. What happens when you have 50 grams of glucose and 25 grams of proteins? You see a difference on the amount of glucose in your system. So you look at that slide, you say, well, I have a patient that has high blood sugars, then I'm going to eat proteins with that, I'm going to use certain things. For example, in this slide, you're going to say, oh, soy is awesome. Never freaking eat soy. Don't ever have soy. I don't give a shit when they tell you, I'm detoxing you, I'm doing this with you. Soy is, you know what we give pigs and cows to make them fat? Soy. Okay? Do not eat soy proteins. You don't want them, you don't know what goes on. I've been there, I've seen it, because I worked for a huge company then, and I saw what they did. You do not want to eat soy proteins, okay? But if you can see, bodybuilders love to eat egg whites, right? They're one of the dumbest people in the world, okay? I don't like bodybuilders, okay? When God created proteins, I know she's covering her face, oh my God, I eat egg whites every morning, look at her. Yes, she does. Okay, when God created proteins, have you ever seen a chicken shit an egg white? Never. You have never seen that, have you? They eat food and they shit an egg white with egg yolks. And the reason God intended to do that, there's nothing in nature that has proteins and no fats. Nothing. Everything that has proteins has to have fat on it. Because you have to slow down the digestive system, slow enough so you can digest those proteins. Because what are bacteria made of? Proteins. What are viruses made of? The capsule. Proteins. So what differentiates us, the food between food and those people, bacteria and viruses, don't have what? Fat on it. So the body needs fat to differentiate between proteins from the enemy and proteins for food. So you need fats, okay? Make sure that you eat fats when you eat proteins. Hey, now, this is also done on a diabetes type 2 and a healthy person. And here, what they did, they give 50 grams of glucose and 50 grams of protein. And see what happens. Look at the healthy person. Plasma glucose steady, but look at the insulin levels on the type 2 diabetic. They go way up. Got it? So they have a different response metabolically to when you eat. Now, days of fasting, oxidation. If I go 5 days of fasting, and I don't see many people doing that, carbohydrate is almost none. But what is the second choice here? Proteins. Remember when I told you at the end of the lecture, your body will eat the protein. Will you go? I know if you're a bodybuilder, if I don't eat, I fast, I'm going to lose all my muscle mass. Give me a freaking break. To lose muscle mass, you can lose it. You're not going to lose 10 pounds of muscle. First of all, to gain 10 pounds of muscle is hard. To lose it is also hard. So, can you go 2 days of fasting? Absolutely. Hold on a second. Oops. Okay. I put this slide right here and I want to read hepatic glucose production. The rate of release alanine from the muscle is reflected by blood concentration. So when you're fasting, your alanine levels go up. Alanine is an amino acid that is broken down in the liver or in the muscle. So muscle cannot dump out proteins, cannot dump out glucose. It cannot do that. So it comes from where? The liver. So the muscle can break down muscle and it changes to iron and it dumps it out so the body can use it. The other reason I put here is that it does appear that the blood glucose levels in starvation is controlled by muscle breakdown. Let me repeat that. It appears that blood glucose levels in starvation are controlled by muscle breakdown. What is starvation? 2 or more days without food. Okay? That's what the definition of that paper. So you do break down muscle when you're fasting. But the amount of breakdown is not so large that you're going to lose muscle. Okay? Rick, don't worry about it. Okay. Now, this is a study they did, and they compared yeast, mouse, and humans. Okay? And this is no fasting. This is a fasting mimicking diet. So they even brought a new subject here. What if I use a fasting mimicking diet? You guys know what a fasting mimicking diet is? This is pretty cool. This studies here is done, and I should have the guy's name. I cannot believe. Oh yeah, Mingwei, blah blah blah. Valtel de Longo. Valtel de Longo has a company that is creating a number of supplements that he calls fasting mimicking diet. So you really don't fast. You just eat these foods and you act like you're fasting. Okay, the research is actually very impressive. It does shows. Or all he did was take shit out and give you his shit. Okay? But I'm going to explain what he did in a second. Now, in this one, it was very interesting because out of 4 weeks, they fasted only for 1 week. Or they used the fasting mimicking diet for 1 week. Did they lose weight? Absolutely. So remember I talked about weeks, hours? I can fast for 1 week and I will lose a lot of weight. Even though I eat shitty the other 3 weeks. It's pretty impressive. Now the fasting mimicking diet, the caloric intake, you guys see the last 5 days of every month, 34% normal caloric intake, and the composition was only 9% proteins. And remember when I told you about fasting proteins? So these people, what were they doing? They were fasting with proteins. So they eliminated shitty proteins and they used their proteins. Now it's kind of funny because you use 47% carbohydrates, 55% fat. They're still eating. Do you guys consider that fasting? No, it's not, but it's considered fasting mimicking diet. It makes a difference. And then here why we identified that diet that mimics the effects of fasting. So we're using a diet to mimic the fasting. So act like it's fasting but you're still eating, okay? And the markers of stress were all down, levels of glucose were down, IGF-1, high levels of ketones, all that stuff changed to a better. Now, what is a fasting mimicking diet? A human diet, I put it here. It consists of proprietary blend of vegetable soup, okay? Proprietary blend of vegetable soup, energy bars, energy drinks, chip snacks, flour tea, and a vegetable supplement formula tablet. So what were they doing? They were basically using a military type of food, fake food to make you lose weight. Now, note that the blood tests were pretty impressive. I wanted to tell you, because they only ate 725 kilocalories. That's pretty low, very low. So how many grams of protein do they eat? Only 10 grams of protein. So you're going to lose weight by using that little protein. Even though it's not, eating, because you eat only 10 grams of protein, you will tend to lose weight. So on a female, hold on a second, okay? In a female, I use absolutely manipulation of proteins to lose weight. It's going to go against everything you have learned. But if I ask somebody to get married, I might lower the protein intake to 40 grams. And they go, what? Yes. You're going to fast proteins. You're going to eat protein only one time a day. Just kidding. What's your question?
When you say you lose weight, what did they lose? Because you can do that with water.
I absolutely agree with you. But, first of all, they use chips. Okay?
No,
so,
but I mean, what did they lose?
Oh, let me see. I have it.
They lose
hold on,
fat.
I tell you.
Did they lose water?
They lost fat. Actually, it was pretty impressive. Hold on a second. Let's see. Control That was on the rats. Hold on a second. Let me see. In humans, let's see. I know they lost over 5 kilograms of body weight, but I cannot remember what percent was fat, but it was more fat than anything else. Yes? I agree with you. I'm just telling you what the research shows. I just want you to be aware of the fasting mimicking diet. You guys didn't know what it was, but now you have a subject or a client, I want to do the fasting mimicking diet. All you have to do, what's your answer?
Eat less.
Eat less! Shit, absolutely. But the key there is the amount of protein they're eating. It's only 10% out of, let's put 1,000 calories. That is nothing. So that's why this is a huge, huge thing in medicine right now. People are coming now, oh, I want to do the fasting mimicking diet. They're going to come to you and they're going to tell you, I want to do the fasting mimicking diet. So basically what they're doing is they're using just vegetable soups, okay? They're using chips and bars. That's just very, very low protein. If you only eat 10 grams of protein, see what those bars are made of. What do you think they're made of? Freaking sugar. Okay? I just want to show you. What was the fat percent? Was 44% fat, 47% carbohydrate. So we're eating 40 grams of fat. That's still not much. Yes?
I'm just wondering, what's the reason for to reduce the protein in particular?
The question is, what is the reason to reduce protein? Okay, most people think that for me to gain muscle, I gotta use massive amount of proteins. When you're taking, I'm not talking about people taking anabolic steroids, a whole different ball of wax. I'm talking about normal people every day. Okay, how much is the minimum dose that you require to maintain muscle? Do you guys know? What the research shows? You guys any idea? They give me an answer, 0.8 grams per kilogram. That is wrong. No. How much? Between 40 to 60 grams for maintenance of your muscle mass. That is in a non-active person.
Where's that going from? Where are you getting that stuff?
That is the research. Look it up. Minimum amount of protein required to just maintain body mass or muscle mass. Between 40 to 60 grams in a non-active person. Okay? For example, let me give you a best sample. Who has parents here? I hope everyone has parents, okay? Do you guys see your parents eat? As they get older, they eat less and less. Have you guys noticed that? And their body weight maintains the same. Some people that I see, old people on nursing homes, only once a day and they keep their body weight. Well, they don't move. They don't do nothing. They become inactive. Okay? Just be aware of that. Now, if you're exercising, then I'm going to start using 0.6, 0.7, 0.8. In females that are active, and I want them losing weight, I might use 0.6 grams per kilogram. It works wonders for them. They keep the lean body mass and they lose weight. Okay? So be aware of that. Now, fasting and body composition, absolutely fasting changes your body composition. It's no big deal. These people, what they did, they alternate day fasting. So what they did for 12 weeks, they ate pizza, ice cream, whatever they wanted, and then the next day they didn't eat. Then the next day they ate pizza, ice cream, whatever they wanted, and they lost weight. So even intermittent fasting, this is going to 24 hours on, 24 off, they did that and they lost weight. That's pretty impressive.
What was the effect of the, what were the other things as markers?
What do they use as markers?
What were the other things as markers? What did you just body comp?
They only use body composition. They only use, actually, they use a health marker here. I think I'm gonna have it here. Hold on a second. I didn't put, hold on, what health marker? If you notice asking me which health markers they use, body fat, blood lipids. Okay, that's it. Okay, I want you guys to hear this. In every study that you're going to see about fasting, mimicking diet, intermittent diet, the health markers are always lipids as a health. It is absolutely bullshit. Every paper that you're going to see, health markers will use cholesterol as a health marker for you. And if they reduce cholesterol, they think that you're doing what? Better. Wrong. It's not a health marker. Actually, as you get older, as you become Kenki Naki's age, okay, the lower your cholesterol, the worse it is for you. Let me repeat that. As you become as old as Kinaki, the lower your cholesterol, the worse it is for you. The higher the chance of dementia, the higher the chances of cancer, the higher the chances of joint pains. You never want your cholesterol low if you're 55 years or older. Never ever have low cholesterol.
Eric, the restriction of protein with the fasting of protein, would that be good for obviously the likes of Alzheimer's and stuff like that?
Is the fasting of protein good for Alzheimer's? I try to keep it to research so people don't talk crap. In Alzheimer's, depends when you catch the patient, but yes, it can make a difference.
Okay.
It depends how advanced Alzheimer's is. Okay. Now, Alzheimer's, another name for Alzheimer's is diabetes type 3. Okay. So now they know after doing autopsies that the brains of people with Alzheimer's have chronic vascular changes due to sugars. Okay. I want you guys to be aware of that. So, lowering protein or inducing a little bit of fasting in Alzheimer's patients, they do better. I see Alzheimer's patients, when they eat sugar, they get worse. Is it because they're inducing more damage, or is it because... Okay, before I start, any questions about yesterday? Because I got some people complaining to me yesterday that I taught too much biochemistry and science, so I made changes to the slide so there's not too much biochemistry or science on this one. So I want to make it pretty plain and simple. To fast or not to fast? Yesterday I asked you girls and boys, who have fasted here. Half of the room raised their hand and the other half didn't. And when you go to sleep, it's absolutely fasting. Now, what is the definition of fasting? And, what is fasting? Well, first of all, these are all types of fastings that are out there. I know that what you see in the literature is days or hours or whatever, but I want to teach you today things that I will use in my office so you guys can use it. Now, when I talk about fasting, I talk about taking a period of time in which I will not consume or eat certain things. Okay? Now, questions that people usually ask me before I start is, if I drink coffee, is that still considered fasting? Things like that. I know you guys are going to come up with questions, so I want you to be aware you can ask me anything. Now, there are different types of fasting. I'm going to classify them as like hours, because as I go through the research, you guys will see what I'm talking about. You guys know what dry fasting is? No. Dry fasting is when you don't drink water at all or eat food. Yes, I have stupid patients in my office. One of his, I'm going to break HIPAA rules here, Chris Roney. I have a patient that for 4 days, he didn't eat or drink water. Now, most people will think that is crazy and stupid, okay? But it's the first 48 hours of the dry fasting, again, it's no eating and no drinking water, are very, very hard. In the literature, people tell you that you cannot do that you will die. But do you know that when the mitochondria is burning or making energy, what are the two byproducts that you get from the mitochondria? Okay? Water. It's water. Okay? You release hydrogens and you get water. Okay, so the body actually makes their own water. Now, where is the earliest documented fasting? You guys know? Does anybody read the Bible here? Jesus spent 40 days? In the desert. And there was no water fountain there. So he came back from death. I'll do what he does, by the way. So that is the early documentation of fasting. So that tells you it can be done. Now, you guys are going to learn, I'm going to ask you how long can you go with fasting. Now, this intermittent fasting means it's a period of time that I do not consume food. It can be minutes, it can be hours, it can be days. Okay? So, I'm fasting because I'm fasting every 5 minutes. I have stupid people in the office. I am fasting. How long do you fast? 2 hours. It is fasting, okay? I can't argue with them. Macronutrient fasting. I'm going to introduce this concept to you guys because you guys are not aware of this concept. Now, when I say macronutrient fasting, I mean I'm going to take away a certain macronutrient out of your diet and I'm not going to let you have it for a certain amount of hours or days. Why? For example, Do you guys know that the order of consumption of the food that you eat makes a difference what's going to happen to the response, metabolically response on your body? For example, a lot of people here will eat fruits or something before you eat your breakfast. Well, that is the wrong way to eat if you want to lose weight. You should always consume your protein first and then consume your dessert or whatever after. It will slow down the rise in blood sugar. You have done it. It does it for 3 hours. You also know that if you eat a bad breakfast, the bad breakfast is going to do damage to your body for 12 hours. But if you eat a good breakfast and eat a bad lunch, only 4-hour damage. So that makes you aware of what can happen to the body. So for me, macronutrient fasting means I'm not going to let you eat carbohydrates, fats, or proteins, whatever my choice is, for a certain amount of time. In females, I will limit the protein intake and they lose weight pretty fast. But I will teach you a little bit in a second. Now, there's also types of proteins. I can say, I'm going to make you fast away from red meats. I'm making you, fast with certain protein shakes. And I have, in my closet, if you go to my house, I have a closet just full of supplements. Because so many companies want me to talk about them or they send me free products. I mean, I have stacks and stacks. I don't like protein powders. So one of my biggest things is to fast from protein powders, believe it or not. And people usually will get better just by doing that. I do not like protein powders that much. I use them at specific times and in certain quality. For example, I have people that I made them fast from whey or KC. 99% of those people feel better, don't they get bloated, and I will do another protein. I will use collagen or colostrum depending on what I'm doing with those people. The next type is carbohydrates. I might make you fast from starches. I might make you fast from any carbohydrates at all. And the last one, do not ever make you fast from fats. I always use fats as my main driver. So I can manipulate nutrition on my own fats. Okay, here's fasting periods, hours, days, months, or years. Yes, I put years there, and I'm going to explain why in a second. So I want you guys to be aware the amount of fasting that you can do is also dependent in your body size. The bigger you are, fat-wise, the longer you can go. The more muscle you have, the longer you can go, because the body will eat itself if you go a certain amount of period. Now, fasting requirements. Can anybody fast? Well, again, here we go. It's depending on your health state. If you make a diabetic fast and that person is taking insulin, what are you doing to that patient? You might kill him. Okay? So don't be stupid. Don't be stupid again. Don't assume, oh, I know fasting, I have a diabetic patient, I'm going to make them fast. You can, because I use fasting with diabetic patients. But if that patient is taking insulin or is taking medication, that's why I put that there, be aware of that. Medication that will affect fasting, beta blockers affect fasting a lot. Okay? Any oral metformin affects fasting. Actually, metformin is good for fasting because it helps you lose weight. So be aware of all those conditions. Now, goals: do you want to lose weight? Do you want to gain weight? Do you want to get leaner? Are you going to get married? I use fasting when you're going to get married. How active are you? What are you doing? If you're going to be running all the time, I'm not going to put you in 24-hour fasting because you're going to look like shit and feel like shit. So it depends what you're doing. Also, Dr. Alexander was talking yesterday about HRV. I have some people that fasting is really beneficial, and I have some people that fasting they don't do too well because they have some kind of metabolic thing that I've not seen yet, but the heart rate variability helps me. Economics. Oh, I love this. I have no money to buy good food. Well, I'll fucking fast. Okay? That is the best. Oh, I don't have money to do. You don't have money? I have the answer for you. Don't eat. Okay? Let's save money. You know, I also have people that come to the office. I have money, but they smoke 2 packs a day. Don't give me shit. I am an asshole in the office. Genetics. There are certain conditions, SNPs, that allow you to do better with fasting. If you have an MTHFR mutation, based on what I see with fasting, actually helps it. I don't know why, but I see people that do get better. Supplementation. If you're going to fast, can you supplement? Absolutely. Do I count that as part of the fasting period? Yes, I do. So you can do have certain, remember what I said, I can fast from macronutrients, I do that, but I'm gonna have you have free form aminos. I'm gonna have you try change aminos. I wanna have you fast. It depends what I wanna do. Religion, absolutely. Religion is the most basic form that's used for fasting, okay? Because you wanna fast, because you're a sinner like Stephen yesterday, getting home at 4 o'clock in the morning, you know? So he's gonna fast today. Age, if you are an old, fragile man, like me sometimes, fasting sometimes is good, sometimes it's not good. Something that I do not put here is job, fasting. And this is going to sound weird to you guys. I fly a lot. On the last 8 days, I took 7 different flights, and I fasted the whole time that I was flying. Why? Because the food is freaking shitty on a freaking plane. When they give you chicken, have you read the label of the chicken? It's not even fucking chicken. It's crazy what it is, okay? So be aware. So I can use jobs as a form of fasting. For example, and this is a big one. Oh, I work with all these people. Oh, they bring donuts. Oh, I have a little violin in the office, and I take it out, and I play music for them. So I said, really? So you're fasting? Oh, I gotta eat. No, don't give me shit. Don't eat. They bring you donuts, don't eat it. No, but my favorite one, nurses. I have a nurse practitioner that is jacked. Where's Robbie? Is she jacked or not? She's jacked. Okay? True or false, Ryan? Sam.
Yeah.
She's jacked. I mean, bigger biceps than I do, you know, all that stuff. And, you know, sometimes I make fun of her because she can eat freaking anything.